Hi everyone, thanks again for joining me for our video series that Gallup is conducting with chief nurse officers across North America to really learn about how they're handling the challenges of COVID-19. Today I have the pleasure of speaking with Sean Chilton, VP of Health Professions, Practice and IT from Alberta Health Services. Alberta Health Services is the only centralized health authority in Canada with over 100,000 employees, 10,000 physicians, and serving over 4 million residents of Alberta. Gallup has had the pleasure of working with them directly for a few years, and I'm just constantly amazed with just how much this innovative system has been able to accomplish in a centralized fashion. Sean, it's so great to see a familiar Canadian face. Thanks so much for joining me.
Thanks, Melissa.
Can you start with briefly describing your role at AHS to me?
Yeah, so I'm, as you said, the Vice President of Health Professions, Practice and IT. I have responsibility and oversight provincially for professional practice and education for nursing, midwifery, allied health rehabilitation services. I also look after clinical and organizational ethics, regulations, student placement, information technology and clinical informatics, as well as clinical and corporate policy, workforce planning, optimization, and staff scheduling.
Sean, can you please describe some of the challenges you are facing as you anticipate what is coming up in the next few weeks for Albertans? What are AHS leaders doing to manage some of these challenges?
Yeah, I'll maybe put it into two different perspectives. And I think first and foremost, the most important one is supporting our staff. This truly is an unprecedented time in healthcare. It's something that many of us will never get to experience again, hopefully or thankfully. We truly are putting new and different pressures and stresses on our teams throughout the entire system. So it's impacting everyone in one way or another, whether it be on a personal basis, through social distancing, homeschooling, lifestyle changes, impacts to family members, having to work from home, or whether it be on supporting people in the front line and providing direct patient care. Whether you're in information technology, whether you're a frontline nurse, whether you're a support service, every single person across the country within the province is being impacted by what's happening. And so they're not only worrying about their own safety as they come to work to provide care to patients, but they're also worrying about the safety of their families. What am I taking home with me? But at the same time, trying to wonder, how do I support a household? How do I work in this new environment? For those that are working at home, that's a whole new set of challenges. But from a frontline perspective, how do I do that safely? Am I appropriately protected? Can I care for my patients in the right way? And so I think people are scared. Sometimes they're anxious about what's happening and what's going on. I was talking yesterday actually to a nurse, and she has 3 boys at home, single mom. And she was saying to me, I work all day, I'm stressed, trying to, am I appropriately protected? Am I caring for patients the way I need to? And then I have to go home and homeschool them and provide that support. And I think we need to remember that this is actually impacting us not only in the work environment, but in the personal environment. And so we have to find ways to support our teams and our staff across the entire system. And because if we don't do that, they're not going to be able to provide the care that they want to provide, and we need to ensure we can minimize the risks. So I think supporting staff is one of the key ones. The second one I'd say is just making sure that we have the right equipment and supplies and things there, the resources that staff need in order to provide the work that they need to provide. Working in personal protective equipment all day and every day for many is new. It's a new challenge. It's a new way of caring. For patients, it's a new experience. It's scary enough going into a hospital sometimes for many people, but now everyone's coming at you with masks and goggles and gowns, and that's frightening. And so preparing people and staff and making sure that we've got enough equipment to support them, enough resources to support them. And resources is more than just equipment. It might be human resources, redeploying staff to high need areas like the critical care areas, and making sure that we've got the right capacity to deal with the growth that we're expecting in patients and cases. But again, I think we tend to focus a lot on our hospital-based care, and we can't forget all the work that's happening in the communities, the contact tracing, the assessment centers, and all that background work that's helping to prevent people from ending up in our facilities. And so I'd say, supporting staff, number one, but helping protect our staff so that when they come to work, they can feel safe in the system. They can feel safe providing the care that they need to, but at the same time have the resources that they require in order to do that effectively.
Thanks, Sean. I just think that there's so many elements that you have to think of being such a large system. And I think you did such an awesome job of describing how you're starting to do that. I think you touched on a little bit of this in my previous question, but I wanted you to elaborate a little bit more. Obviously, emotions are a little heightened everywhere right now. And we can't even imagine what it's like for our healthcare workers on the front line specifically. How are you managing well-being of AHS staff, potential burnout, and really just the ambiguity around them understanding what their new day-to-day roles are?
Yeah, it's a great question. And I think first and foremost is we need to be providing information, and we need to be responsive to our providers. And again, when I talk about frontline providers, I mean not only the people who are working at the front line directly with patients, but those in the background that are providing the supports that allow them to successfully work in the foreground. And we can't forget that this is an entire system. It's a big system, and that we all have a role in supporting that response. But I think with things changing so quickly, we need to keep our people informed as much as possible. And more importantly, though, we need to listen to the questions and concerns that they're raising. We need to be able to respond to them in a timely way and share information with them. Even in the absence of information, people will create information. So even if we don't know all the answers, I think we need to be open, we need to be transparent, and we need to communicate effectively and regularly. And be prepared to answer the tough questions and provide the information that people may not want to hear at that particular moment in time. So I think regular updates, establishment of stakeholder focus groups, working with our unions, working with our partners in the communities. We can't underestimate the value that our community partners provide that might not be directly in the healthcare system. And we need to take the time to recognize our teams, acknowledge the great work they are doing, checking in to see what they need to be successful at their work and how we can best support them. So I think information and responsiveness is first and foremost. We have a number of resources. We have, as you know, thousands upon thousands of staff and physicians who are responding to the crisis, and their safety and well-being is essential to providing that care to Albertans. So we do have access 24/7 to support them through our employee and family assistance program, so that they can navigate their own challenges, whether that be professional or personal. And we're also taking a phased approach to our mental health and wellness resource strategy to ensure that staff are supported during the post-pandemic. I think we are right now, everyone's operating on adrenaline. They're doing everything that they can to help support it. But we can't forget that the long-term impacts that this may have on people from a mental health perspective are going to be critical. And so we need to think about that future. And we're encouraging our people to take care of themselves. They need to be proactive at identifying and addressing challenges such as compassion, fatigue, and burnout. And we need to find ways to support each other through that. And so we're doing a lot of work, particularly in some of our high-risk areas, the critical care areas. How can we redeploy staff to help them and to help prevent that burnout so that they're not feeling overworked and particularly challenged, because this is going to be a challenging time. I think the other and the last piece that I would say is sharing kindness. I think we have to show compassion for each other, as I talked about already. And so every day we're trying to share community acts of kindness with our staff, where communities are coming forward, hand-drawn pictures, iPad donations from community members and foundations, virtual Easter egg hunts, for kids that are in hospital, are just some of the things that our community partners are trying to do and to help us. And we want to share those with our teams. And I think the acts are a good reminder that we're all in this together, and that this is about an entire community of people who are supporting us, that we're trying to support them, and that they're grateful for the work that we're doing. And we as leaders need to demonstrate that we're grateful for the work that people are doing, and taking the time out of our day just to say thank you, and to appreciate everything that everybody's putting in.
Thanks, Sean. That's great. Like everything that you described. I mean, I think the one thing we can all see is that this pandemic is humanizing everyone, right? And we're seeing more of the human element of everyone that we interact with. I wanted to pivot a little bit. Having worked with AHS for a few years now, I distinctly remember how well Alberta Health Services came together as a system during the wild forest fires and resulting evacuation in 2016. And really just the incredible rallying demonstrated by everyone during that time of crises. Are there any parallels that we can draw from that has helped AHS work through, obviously, that unprecedented experience at the time to now another one with COVID-19?
Yeah, absolutely. And it's interesting, when the fires in Slave Lake, Fort McMurray, and the floods in the south of Alberta hit, what we saw was our staff rising to the occasion and genuinely helping and supporting Albertans. In some ways, it was almost a practice run for what we're dealing with today. They were focused. They were in specific areas. They had clear parameters and boundaries. With COVID, we're actually seeing the entire province impacted. And I think there's absolutely parallels that we can draw and lessons that we learned through those processes that have enabled us to respond as successfully as we have to date as an organization. So first and foremost, that's the people. The people genuinely care about Albertans. They genuinely care about each other and their teams. They're always willing to step up every single day, and that is consistent, whether it be fire, floods, and now in our COVID response. They hold nothing back, and they give it their all to help support the care that we're providing to patients. Just as an example, when we were evacuating our hospitals during the fires, we saw our people stick by their patients. We saw them set up temporary hospitals in an airport hangar. They left everything that they had, including their families and homes, and not knowing what was going to be there from at the end, to give to what they signed up for, and that was to care for patients and to support patients. And so today, people are leaving their homes and their loved ones to fight an invisible and relentless virus. And every day they're doing that to care for Albertans, and then going back to those homes and concerned about what they might be exposing their family members to after their day at work. And so since the beginning of the COVID response, staff have been willing to be redeployed to areas in high need, such as our assessment centres, our 811 HealthLink call centre. We've had individuals at the airports to meet international travellers and provide them with public health information and support screening. And we continue to see an outpour of support from our people across the entire organization. It's amazing the number of emails that I get every day of people asking to help. How can they add more? How can they do more? And what's interesting about COVID is while it's a marathon, there are also sprints involved. And so while people might feel they can do more today, I can guarantee you that as this progresses, we're going to need each and every one of them. And so everyone will be called upon at some point in time. I think as a system, we're also extremely fortunate to have a system that we do. As you said at the beginning, we're one provincial health system, and we're able to tap into teams and expertise across the entire province. Very, very fortunate that way. So during the fires, for example, our contracting team made sure our people were supplied with everything they needed, no matter where they were in the province. And so we've been able to take those experiences and amplify them significantly. And so as one provincial healthcare provider, we've got strong purchasing power. We've had great success in securing large quantities of supplies and the support that we need to be able to respond to the virus, as well as support our staff and Albertans. And so that being one system, and we literally, as some people may not be aware, we cover the whole spectrum from the public health, prevention, promotion, to our acute care facilities, to continuing care, to our EMS services. As one entire system, we're able to respond to the needs of Albertans and come together as one to actually support the provision of care. I think the other thing that I would say is Albertans show tremendous resiliency. During the fires, we saw Albertans and our community partners show their support in incredible ways. Today's no different. Every day we're receiving thank you notes, we're receiving donations, businesses who want to retool their environment so that they can look at things like making masks or supporting personal protective equipment, or how can they 3D print the face masks for staff. And so we're seeing a tremendous, absolutely tremendous response from our communities, as well as support for our providers. So we've seen organized parades with police cars, public signage displays. There was a parade outside my building the other day of people just honking their horn to say thank you for healthcare providers, and it makes you feel proud to be part of a system that's so responsive to the needs and able to step up.
It just really feels like a true testament of the human spirit just coming together, right, from all possible avenues. Sean, finally, what are the positive lessons learned from this experience that we can share with other health systems across Canada and the US during this time?
Yeah, so I think there are probably 2 or 3, but I'll try and hit the ones that I think are the most important. And you'll probably notice a bit of a theme in my response. So first of all, it's that teamwork. We need to collaborate early and often. The strength at AHS and our ability to respond quickly and timely is being grounded in the fact that we're one cohesive provincial team. And it's taken us a while to get here, but I see it each and every day. I see our teams stepping up to actually help support each other. And that we need to remember that we're not in this alone. Not only are we not in this alone as healthcare providers within the system, but we need to recognize that we have tremendous support from our community partners. An amazing collaboration with people that would normally be considered outside of the healthcare system. And so that teamwork and collaboration for me is the number one. It's one of the most important things that we've been able to support. I've talked about this a little bit already, communication. And as I said before, in the absence of information, people will create information. So we need to be proactive, we need to be open, we need to be transparent, we need to get out in front of our people, we need to be genuine, we need to be authentic, and at times we're going to need to be vulnerable. We need to communicate often and frequently and through a variety of different means. And then I think leveraging and maximizing our partnerships with government, communities, regulators, post-secondary institutions. There's a lot of untapped resources who can and want to effectively help and ensure an efficient, high-quality response. So it doesn't matter what industry they're in, people are looking to help support us, and I think we need to think sometimes outside the box and do things in a different way without jeopardizing the quality of care we're providing to our patients, because I think we actually can be very successful. And then lastly, I'd say proactive planning. I think it's keeping an eye to what's happening. And so from an AHS perspective, we plan proactively. We're looking at the surge in demand for health services related to COVID. Since day one, we began capacity planning to meet the needs for additional space in both our acute care and continuing care environments. We've looked at a postponement of elective surgeries, as mentioned, moving seniors out of acute care and into care in the community where appropriate, discharging patients where appropriate, redeploying our staff to meet the high need areas. Our contracting team were looking at the environment back in December and before, and could see what was happening and what was coming, and started to proactively look at how can we secure supplies and personal protective equipment in readiness for what may occur. And so we can't underestimate the value of that proactive planning. And then I think lastly is we need to remember, as I said, this is both a sprint and a marathon, and people are going to be tired out of it at the end of it, and we need to start thinking about how will we support our people when things start to settle down. But recognizing that's going to be in an economic environment that's going to be significantly impacted, and that these aren't just our employees, they're our brothers, they're our sisters, they're our children, they're our mums, they're our dads, and they have a home life that's going to be stressed for many. And so we need to think about how we can proactively support people into the future and as things start to settle.
Thanks, Sean. I mean, that was so great. I really appreciate you taking the time to chat with me. I hope I can come to Alberta. It's maybe not too far from now to come see you guys in person. And also, I love that picture behind you. Is that a picture from Alberta?
It is. That's in the outside the Banff area.
I miss Banff. But hey, thanks so much, and hope to talk to you soon again.
Thanks so much. Really appreciate you taking the time.